the marathon in itself is one to ensure that we encourage healthy lifestyles. So around here, we're advocating on the issue of HIV to ensure that we're able to encourage people to live lifestyles that will help to prevent incidences of HIV, and for people to know what their statuses are so that they can get, treated if they need treatment, and they can continue, safe lifestyles if that is the outcome of their test. But also aside from that, there are other infections, other diseases, even non-communicable diseases. There are many preventive infections, and because of that, we've also partnered with the End Fund, which is whose operations are quite new in Nigeria, and what they do is to partner on programs like the marathon to raise awareness and ensure that people get tested, get treated, and that we raise funds to help to prevent people from dying from avoidable causes.
My name is Oyetola Oduyomi. I'm the Africa Regional Advisor to the End Fund. The End Fund is the largest private philanthropic organization focused on tackling a bunch of diseases called the neglected tropical diseases. So these are a bunch of bacterial, viral, parasitic infections that tackle a lot of people, 40% of which are in Africa. So the Access Bank, which is arguably the most respected bank in Nigeria, maybe indeed Africa, is putting together the marathon, which is an annual event, and they've graciously given us the platform to spread the word on the NTDs, to talk about preventing these diseases that are easily preventable and treatable, and we're very appreciative of the opportunity.
Yeah, first of all, appreciate Access Bank for what it's actually doing, and this is one of our initiatives. The marathon is one of the actually forum whereby Access Bank is creating opportunity for NIBRUCA to latch on this event to provide HIV testing services for the general population. More importantly, for athletes and other people that want to get to know their HIV status. The national prevalence right now is 1.4, but then a lot of Nigerians are yet to know their status. So we're actually using this opportunity to encourage people to get to know their HIV status.
So it is important that we increase our advocacy towards prevention so that we have more people who know about their status and can help reduce transmission and end new HIV infection. We're working towards achieving the 90-90-90 goal, which means that 90% of people know their HIV status, 90% of those who know their HIV status can access treatment, and the 90% of those who access treatment achieve viral suppression. In other words, their viral load is undetectable, and which means that transmission is obsolete. So we need to start working together as partners, both from the non-profit sector and the private sector and the government, towards achieving zero HIV new infections in Nigeria, and ensuring that more people have access to antiretroviral treatment.
Access Bank Lagos City Marathon. Access Bank Lagos City Marathon. I'm running to end HIV/AIDS.
I'm running to end HIV.
I've just been informed about the NTDs, and the NTDs are neglected tropical diseases. They're neglected because not so many people are aware of them, and they're tropical because they occur mainly at riverine areas. Now, the End Fund is the only private philanthropic initiative dedicated at eliminating NTDs, and their 5 focus areas are river blindness, intestinal worms, schistosomiasis, lymphatic filariasis, and trachoma. I have been informed now that you should deworm once every 3 months.
We are here to implement HIV testing services. It is free, it is voluntary, it is confidential. HIV counseling and testing is the entry point to care and support. And we are here, we're working towards the goal, the 90-90-90. The first 90 is to make sure that 90% of the population knows about their HIV status. The second 90% of those that know their status, those that are positive, are placed on care. And the third 90 is that 90% of those that are on care have reached viral suppression. And you can't know if you're positive, if you need this care, if you don't do your test. Even for the marathon race, we know that health is wealth and diagnosis have the cure. So when you do your test, you know how healthy you are, and it will also help you to live healthy, to live positive, and to live longer.
The End Fund is creating awareness about the NTDs, and NTDs mean neglected tropical diseases. So I would encourage you to deworm at least once in 3 months, because deworming helps you to get rid of the NTDs. Most of them are being caused by worms.
Hello, I'm here to talk about lymphatic filariasis. Now, lymphatic filariasis is popularly known as elephantiasis, the big foot disease. Now, for lymphatic filariasis, it is caused by a parasitic worm. However, it is spread by the female Anopheles mosquito. Now, how can we prevent lymphatic filariasis? What you need to do is sleep under a treated mosquito net and then avoid the environments that are dirty. And please, anything you need to do to avoid mosquitoes around your area, please do it. However, you also need to know that lymphatic filariasis is one of the NTDs.
I'm running to end intestinal worms. Make sure you deworm 4 times a year.
Running to end HIV/AIDS, and I am running to end river blindness.
I stand for zero discrimination against people living with HIV and AIDS.
Know your status is very good. I've checked my status. Go and check yours.